This webinar will cover some of the basics of patient volume, aka PV, narrowing in on some of the most common PV errors we run into so you can avoid making these mistakes. To be eligible to participate in this program, EPs must meet the Medicaid patient volume percentage. This means for a 90-day period in calendar year 2019, or in the 12 months prior to the day you attest, at least 30% of your encounters were with Medicaid patients. Pediatricians may qualify for a reduced payment with 20% Medicaid patient volume. You will calculate your PV by taking all Medicaid enrolled encounters in a consecutive 90-day period, including all zero-pay Medicaid encounters, and dividing that number by all the encounters you had from the same 90-day period. And remember, unless you're a pediatrician, the resulting percentage needs to be at least 30%. An encounter is one patient per provider per day. You could have multiple claims for one encounter. For example, you might see a patient for a checkup and have claims for physical, lab work, and a flu shot. That's 3 claims but only one encounter. So be sure you're reporting encounters and not claims. If you need help figuring out how many PV encounters you had in a 90-day period, there are a few ways to figure it out. You'll want to check your billing system, scheduling system, EHR, or anywhere that tells you about the patients you saw and who you billed in that 90-day PV reporting period. When you're calculating your PV numerator, another resource to check is the remittance advice, or RA, that covers the dates of service in your PV reporting period. RAs are available for free through the Message Center inbox on the secure NCTRACS provider portal. When reporting Medicaid zero-pay encounters, be sure you break those out and report them separately from Medicaid paid encounters in NC-MIPS. We verify the Medicaid portion of your numerator during prepay validations. The zero-pay portion is verified only during post-pay audit. Health choice encounters cannot be included in your numerator unless you practice predominantly at an FQHC or RHC and are including them as needy individual encounters. When calculating your PV, be sure your numbers are coming from an auditable data source because if selected for post-payment audit, you will need to be able to prove where your numbers are coming from. We recommend creating an Excel spreadsheet report of the information used to calculate PV and save that for 6 years. The spreadsheet should include the patient's Medicaid ID number, the dates of service, and the rendering provider's MPI. Patient volume can be based on only the attesting provider's encounters or for the whole practice. If you're using group methodology for your PV, please be aware of the 5 stipulations you must meet to use group methodology. This list is available on our website, and you can also pause the webinar to review them. Please note, an EP using group methodology must have seen at least one Medicaid patient during the program year. Also, be aware that as of November 2016, Medicaid no longer allows Incident to billing. This means that each EP must have directly seen at least one Medicaid patient during the program year. The bulletin article where this was originally posted will be made available as a link below. When reporting the billing MPI used during the 90-day PV reporting period, be aware that this might be different than the one you currently use. Be sure that you're entering the billing MPI where NC-MIPS asks for billing MPI. Don't enter your personal MPI that was used as rendering on your claims as your billing MPI in NC-MIPS unless you use the same MPI for both rendering and billing. You can verify your billing MPI by looking in the upper right corner of your remittance advice if you have any questions. And triple check the MPI you're entering to be sure that you are typing in the proper billing MPI so you don't run into any issues. If you build encounters to Medicaid indirectly through an LME, you need to complete the behavioral health template to report these. The template is on our website, on the PV tab, and in the Resources and Webinars tab. Please read the instructions on the template. They will help you fill out the information properly. When attesting an NC MIPS, use the Stage 3 MU Attestation Guide or the Click for Page Help link in the right rail because it helps explain what we're looking for in each field. The guide not only covers each field in detail, but it gives PV tips to help you attest. There are a lot of PV resources out there to help you. The PV tab on our website has more detailed PV webinars, PDFs, and general information. The attestation guides on NC MIPS can help during attestation, and we have a PV section on our FAQ page that addresses common PV questions. You can also contact the NC AHEX who have boots on the ground and can provide more personalized attestation assistance. See the Technical Assistance tab of our website for their contact information. And remember to attest as soon as possible. If you attest by February 28, 2021, we guarantee to review your attestation and we can tell you if we see any issues. No changes can be made after the program year closes, so give yourself time to address any attestation discrepancies. All of the websites I referenced in this webinar will be available as a link below. Thanks for tuning in, and please let us know if you have any questions. Our email address is ncmedicaid.hit@dhhs.nc.gov.